This is a simulated patient task, assessing communication with patient, communication with colleagues, applied clinical knowledge, patient safety, and information gathering. You are the ST5 in the contraception clinic today. You are going to see Anna William, 20 years old. She had unprotected sexual intercourse. She is requesting emergency contraception. You have 10 minutes in which you are requested to take a relevant history and address her concern. So this is a very common station, okay, and there is some safety issues we have to know, okay, before going into this station. So first of all, you introduce yourself by name and role, and confirm her name and age. Then you tell her the aim of consultation. I understand that you are here today because you want to have an emergency contraception. Is that right? She will tell you yes. Okay, so can you tell me what happened exactly? She will tell you a story about her sexual intercourse that was unprotected. So you can ask her, is it with your regular partner? If she didn't tell the details, you will ask, is it with your regular partner or no? Because if she is with another partner, this will put her at risk of catching sexually transmitted infection. So we will advise her to take some swabs to examine her and to see if she got any infection or not. Okay. If with her regular partner, so whether she is having any regular method of contraception or no. And the most important question here is when was her last menstrual period, because this will determine which method you will provide. So if her period regular, so you have to calculate when will be the expected date of ovulation, okay, because we have the Livonnel and uribistal acetate. They are not effective after ovulation. The only option for her will be the intrauterine device, because we have three methods, okay? So if she is before ovulation, you can give her one of the three methods. But if after ovulation, we will tell her the three options, but we will tell her that these tablets may not be effective in your case, because actually the main mechanism of their action is to prevent the ova to come out from the ovary, and we are suspecting that this happened already. Okay. Then you ask her about the full gynecological history. Here we have to take the full history of gyne. So you have to ask her about any discharge from down below, any pain during intercourse, any bleeding in between menses, any pain in your lower part of the tummy or from down below. Did you diagnose before with any sexually transmitted infection or no? And if she is above 25, ask her about her cervical screening. Are you up to date with your cervical screening and everything is fine? And what about, do you have any regular method of contraception? Do you have a stable relationship? Okay. So here the full gynecological history applies. Then you ask her one question. Have you ever been pregnant before? Okay, this is the only thing in the obstetric history. Maybe she got pregnant and she did termination, or she has babies. Okay, so you have to ask this question only. Have you ever been pregnant before? Okay, and then you continue the history. Ask her about her surgical history. Ask her about any medical problem, because if she has any medical problem like epilepsy and she is on enzyme inducer, we have to double the dose of Livonnel. And if she is asthmatic and taking treatment for severe asthma, we have not to give her uribistal acetate. It will be contraindicated. Also, if she is taking enzyme inducer, we will not give her uribistal acetate. So If she's taking enzyme inducer, don't give her Ellaone, give her only Livonnel, but double the dose. But the most safe option for her will be intrauterine device. Okay, so the medical history here is important. Then ask her about allergies. Don't tell her any drug allergies or any food allergies. No, ask her only about do you have any allergies at all? Because some patient may have allergy to copper, so you will not be giving her this IUD. Okay, so don't miss it. You can tell her any allergies at all. Okay, ask her about the smoking, alcohol, and recreational drugs. And if this unprotected intercourse with unknown person to her, ask her whether it is consensual or no. What is meant by that? It is with her consent or against her consent. If it is with her consent, that's fine. If it is against her consent, you can ask her one question. Would you like to take it further? What is the meaning of this question? We are asking her if she wants to inform the police and social services or no. So, would you like to take it further? If she told no, okay. Okay? So, don't forget to ask if she is aware of her BMI, because if her BMI is more than 26, we will double the dose of levonorgestrel. Okay, so these are the most important things. We will ask about the full gynecological history. Why? Because if this patient has history of any PID or sexually transmitted infection or any suspicion that she has infection, we will not give intrauterine device. The thing, if she is asthmatic or if she is taking any enzyme inducer, we will not give Ellaone. And if she's taking enzyme inducer, we will double the dose of Livonnel. And according to the period, if it is regular for her, so we have to know when was the last menstrual period, and we will calculate whether she passed her ovulation date or still didn't come. So if she passed her ovulation date, we will tell her the three options, but the most effective one will be the IUD. The other two options will not be effective, and if she is before ovulation, we give her the three options. Okay, then you offer her examination. You need to examine her vital signs. You need to examine her BMI. You need to examine her uterus by manual examination. Take some swabs from down below to check infection. Okay, and then you counsel her about the options. We have actually three options. The first one is levonorgestrel, or what we call Livonnel. While you are counseling the patient, tell her the trade name better than the scientific name. So don't tell levonorgestrel, urliblistal acetate. She will not understand. They know the drug by its trade name. So you tell her we have two kinds of tablets. One is called Livonnel, the other one is called Ellaone, and one coil which will be inserted inside your womb. Okay, I will tell you each option, what is the advantages, what are the disadvantages, and the choice at the end will be yours. This if the three options applies for her. Okay, usually better to start with the coil because they prefer it as the most effective method. Okay, and then you tell about the tablets. Okay, so regarding the coil, this is a small plastic coil in which there is a wire from made of copper, and this coil actually will be inserted after taking your consent from down below to be inserted inside your womb. Okay, at the same time we will provide you with antibiotic prophylaxis so that you will not get any infection inside your pelvis. You know, this is very important patient safety issue because in UK usually they will never ever insert intrauterine device unless they do swab and culture and detect there is no chlamydia. Okay, so here, because the patient is requesting emergency contraception, there is no time to wait a result of a culture. She needs the method right now. It is better as much as you can to give the method earlier. Okay, so no need to wait the result. So we will insert the intrauterine device and we will give her the antibiotic prophylaxis for chlamydia. So we'll tell her at the same time you will be provided with some antibiotics which will protect your womb from getting infected. And this method acts by, you have to tell her what is the mechanism of action, acts by preventing the fertilized ova from being implanted inside your womb. Okay, and it can be effective up to 5 days following your first intercourse, or 5 days from the earliest estimated date of ovulation. Okay, so either 5 days from the intercourse or 5 days from the date of ovulation. One thing I want to tell you, during the history, ask her if this is the first time to have unprotected intercourse in this cycle, or you have it before. Because if she has any unprotected intercourse before, this may increase her risk of pregnancy. And ask her whether in the first time she got any emergency contraception or no. Okay, and insist on her that there is a high possibility of getting pregnant, and you advise her for long-term contraceptive method, which is the intrauterine device. Okay, this is if she's having for the second time or recurrent time in the same cycle. Okay, but if the first time, you will be okay. This IUD, it is a procedure. It is a simple procedure done in the clinic, and it has some, as you know, it has advantages to protect you from pregnancy. Its failure rate is very less. Okay, but the problem that it has some side effects. We have common or frequent side effects like abdominal cramps. You'll feel some cramps in your tummy. You may feel some spotting after the insertion, or you may have some discharge or infection even. Okay, the serious complication is either injury to the neck of the womb or injury to the womb itself, which is called perforation. So if we suspect that issue while we inserting it, don't worry at all. We will remove it soon, and we will be kept under observation according to you have any bleeding or not, according to your condition. Okay. There are other rare risks that sometimes the thread may be disappeared. So later on, while you are coming to remove it, it will be a little bit tricky, and sometimes it may fail, and you may get pregnant on top of IUD. Okay, but it is very rare. So these are the risks. If you decided to use this method, you will be requested to sign a consent for that, and we will insert you this method now in the clinic. The other two methods are actually tablets. You will take it in by oral route. I will give you the prescription. You will get it from the pharmacy. The first one is called Livonnel, and it contains some hormones. The dose usually it's 1.5 milligram. Okay, and it's effective within 72 hours from the unprotected intercourse. And its mechanism of action is to prevent your ova to come out from your ovary. So if this happened already, this Livonnel will be not effective in protecting you from the pregnancy. Okay. Actually, this Livonnel can be used more than once in the same cycle. Okay. And we need to double the dose in one of the three conditions: if the BMI is more than 26, if the weight of the patient is exceeding 70 kilogram, or if she is taking enzyme inducers. Okay. The third option is the Ellaone. Actually, it's oral medication also. Its action also to prevent the ovulation, and it's effective within 5 days from the unprotected intercourse, but it is contraindicated with severe asthma or enzyme inducer. Okay. And for both Livonnel and Ellaone, the patient has to use a condom as a backup method until the effective regular contraceptive method starts to act. Means that if she is on tablets, contraceptive tablets, or any effective contraception, so you have to give her the condom until you get the effect of the effective method contraception. Means that sometimes we need to start a hormonal contraception right now, and because she has missed the pills or anything like that, so we will tell her to take backup method until like 1 week or like that. Okay, so we will give during this period a condom to be like a double protection and so on. So this is if she is taking any contraceptive method currently, and she missed any pill or anything. Okay. But for Ellaone, if the patient is taking hormonal contraception, she will not be allowed to start it unless after 5 days of the taking the tablet. Okay. The least effective is Livonnel. The middle one is Ellaone, and the most effective is intrauterine device plus antibiotic prophylaxis. These are the three methods. We have to tell the patient if she chooses the oral tablets, and if she takes the dose and vomited within 3 hours, she has to repeat the dose. And for the three methods, there is a risk of failure. There is still no method is effective by 100%. So after 3 weeks, she has to come and do pregnancy test, or if her period is delayed, she has to come and do the test. Okay. And you advise her for long-term contraceptive methods. And if the patient did this unprotected intercourse with unknown person, you have to take from her a swabs, or advise her to come after 1 week to take a swabs and screen for sexually shedding infection, to be confirming that she didn't get any infection. Okay. And the most important here is to advise her for long-term contraception. Thank you.